Hello, I'd like to speak to you today about Lipogems, an exciting new treatment that we have for the management of painful joints. It treats arthritis as well as a multitude of other different indications that we won't focus on today as part of this lecture. Really, I want to focus about arthritis. I'm going to introduce the concept of Lipogems, how it works, some of the background, and then some information about the procedure should you want to undergo this. What will happen on a day? How will you be managed? How is the fat harvested? How does it work? In terms of my background, I'm a specialist knee surgeon and I have an interest in joint preservation, particularly in new and exciting ways of managing painful joints that don't involve joint replacement, though I do carry out joint replacements. My particular interests are in the field of osteotomy surgery and in the management of cartilage defects in young and active individuals. I also have a complex ligament practice and I receive patients from all over the country, and in fact many international patients come and see me because of my expertise. I've been very excited about this treatment, Lipogems, as I've watched it grow over the last few years, seeing friends that I've developed through my own travels using this treatment and talking about their very, very positive results. Since its introduction, Lipogems has now carried out, as of August 2017, over 20,000 cases. It won a prize for the best innovation in sports medicine in 2016, and we really think it is a very exciting way of managing joint pain, tendon injuries, and musculoskeletal problems. In terms of location, we're actually carrying out the treatment in central London in Harley Street, and you can find out more about this on the website, and the web address is shown now on the presentation. Whenever I bring in a new treatment into my practice, I always make sure that it is done so in an evidence-based fashion. So at Basingstoke, where I set up my knee preservation foundation with Winchester University, which I have an associate professorship, we do everything in an evidence-based fashion. So I have fellows, some of whom are clinical, some of whom are non-clinical, working behind the scenes together with our research team to collate data and tell us which of the new treatments are working and which aren't. And it's very important for us that should you commit to having Lipogems treatment, that you also commit to allowing us to score you both before the surgery and after the surgery, so we can be objective such that we can present our 1 year, 2 year and 5 year results and be evidence-based. Who are the best people for this treatment? What are the best indications? What are our results? And if it doesn't work, we can be honest about it and we can talk about where it didn't work and where it worked best. So evidence-based is how we want to be with this treatment, and it's very important that we have participation from the patients who undergo the treatment. So the big question is, when we're faced with an arthritic joint, do we have to treat it with surgery, or are there non-surgical methods that we can employ other than bracing and physiotherapy to help the patient improve their quality of life? And the field of regenerative medicine has really exploded in the last 10 years and has helped us along this path, and there's no doubt that the future of the management of joint pain is going to be in tandem now between clever orthopedic surgery and clever biological treatments. Currently marketed are many biologics. We have high hyaluronic acid or viscosupplementation. We have platelet-rich plasma, PRP, amniotic tissue grafts, bone marrow aspirate concentrate, and more recently, adipose tissue. Taking viscosupplementation, which is something that I've used in my practice for many years, it does have a place, but its role is limited, and we only see short-term benefit in the vast majority of patients. What about PRP? Well, we can see on this video that's now playing on the presentation that through a simple blood test, and all the companies that we work with have very similar systems to the Arthrex system which we see here, we can take 10 mils of blood, we can put that into a centrifuge, spin it for 5 minutes at 1,500 RPM, and what that gives us are cells that go to the bottom and growth factors that sit on the top. 3 or 4 of these injections a week or 2 apart can significantly help in the management of joint pain, and we've got good evidence to suggest that's the case. And this is something that I do employ in my practice. But what about fat? And this is where Lipogems comes in, and the fat-derived systems. So there are 2 different forms: manipulated, where we use enzymes, albeit human or animal, or minimally manipulated, where we don't use any enzymes, we just clean, and in this case with Lipogems, fragment using the Lipogems device and break up the fat and expose the pericytes. Now, it is possible to have manipulated stem cells derived from fat, but there are only 5 or 6 clinics globally that will allow you to have this treatment, and it's extremely expensive. Carlo Tremolada, working in Milan, Italy, came up with a very interesting concept approximately 7 years ago. Having worked with fat over many years, he realized the rejuvenation, the potential for rejuvenation using fat in plastic surgery. And from this began to develop the ideas that brought about the Lipogems device. The plastic surgeons have known for decades that fat is a very useful tool in facial and in rejuvenation in general of the human body, but particularly in aesthetics in the face. And Carlo and the Lipogems team got together and developed his very clever Lipogems, for want of a better word, cocktail shaker, which is the device that we use to prepare the fat. So in fat we have the ingredients for tissue regeneration. We have cells, we have a scaffold, and we have growth factors. You can see on the next slide Arnold Kaplan, a real giant in the field of regenerative medicine, and famous because he identified the mesenchymal stem cell as early as 1980, so a long time ago. And he's really the father of the MSc and has been supporting Lipogems as a treatment since its inception, and works very closely, in fact, with Carlo Tremolada. The nice thing about fat is most of us have got a little bit to spare. And even in slim individuals, it's easy to harvest this fat from the buttock, from the flank, and get sufficient to do this treatment with the minimally invasive approaches that have been developed. What we're really talking about here is a fat transplant. It's fat transfer from one part of the body to another part of the body, and that's why it's allowed, and that's why it's safe. And we know that this has been available and safe for close to 100 years because the plastic surgeons have been doing such treatment for many, many years with safe and good results. And what we're really talking about, and if we look at this fantastic picture, this electron microscopy picture from Bruno Peot, a professor working in Scotland currently, who shows what the real ingredients of the Lipogems are, which are these little pericytes, which we can see dotted along the vessel in great numbers in fat. And these pericytes are pre-stem cells. So if we look at the next slide, the pericyte gets activated, becomes an MSC, becomes an active MSC, and then becomes a regenerative MSC with the capabilities to bind to certain pain receptors and reduce pain in the same way that morphine works at the so-called mu receptors, and also create a code of activity and change the biological environment of the joint, and in doing so reset the joint. And we do indeed see regeneration of areas of cartilage whether it's to the joint surface or whether it's to the meniscus with this treatment. So if we look at the actual technique, I think for many patients it's nice to see an animation as opposed to a live demonstration of this, and there's a very nice demonstration via animation that's come to us from the Lipogems website. And we can see how it works. We first of all paint and prepare the abdomen and draw where we're going to make our lines and where we're going to be passing our our syringe to actually infiltrate and then aspirate the lipogems. And what we do then is we mix up a solution of adrenaline local anaesthetic and normal saline and put roughly 200 mils into each side of the abdomen by passing very gently and carefully into the fat layer. This is incredibly well tolerated. The vast majority of cases can be done without any irritation at all, without any kind of anaesthetic. I actually think it's quite nice to have a bit of sedation for something like this, but it's certainly not necessary. It's very well tolerated. Once we've put the so-called tumescence into the fat, we leave it for 15 or 20 minutes, we're then ready to go. We then take a second syringe, create a vacuum, and just by gently moving it backwards and forwards, we can aspirate the liquid fat, which is oily and which is blood-stained. And that's what we need to then treat with the Lipogems device. If we go on to the next slide, we can see how the Lipogems device works. We can see, in fact, it looks and behaves very much like a cocktail shaker. And within it, within the Lipogems device, which we fill with saline, are large ball bearings, which, as the cocktail shaker is moved up and down, fragment the fat, which is infiltrated through the top, as you can see, in small aliquots. It's fragmented and it's washed. It's fragmented and it's washed. And in doing so, we get very, very pure fat. This is then taken and removed, and we can see in the next slide fairly red-stained, blood-stained fat and the Lipogems fat that we then infiltrate. We need approximately 6 mils, 6 cc's of fat for every joint that we want to inject. So we need to take roughly 70, 80 mils of raw fat to create enough to inject a joint. If we look at the next slide, we then go on to inject this into a joint under ultrasound guidance, so we can be very accurate and precise about where we want to put this, whether it's the shoulder, in the subacromial space, in the main shoulder joint, into the wrist, into the elbow, into the hip, into the knee, and so on. And often patients are coming to us and saying, well, my main problem is my right knee, my left knee is also a bit sore, but my shoulder is also painful, and we will inject multiple areas, because when we have this fat, it's only going to be able to be used there and then. The excess is then discarded. Hopefully, in the not too distant future, we're going to be able to store the fat so patients can come back, and having been through the procedure, if they need to have it repeated, it can be repeated without having to have any further harvesting. The vast majority of patients are only going to have this treatment once. This is not a repeat treatment. This is not something where you come back every 3 months, every 6 months. 80% of patients will respond according to the experiences so far globally. 20% won't. Of the patients that respond, the vast majority are still seeing a positive effect at 2 years. This is not a short-term gain. And we're not saying it then ends at 2 years, but we're saying at 2 years the current results, and we have short-term data, are looking very positive at 2 years. In terms of your journey, currently we're doing this, as I say, in Harley Street. You'll travel up to Harley Street. It's important that everyone meets first thing in the morning, so it's usually an early start for the morning list and a lunchtime start for the afternoon list. For those patients that want to have sedation, they will discuss this with the anaesthetist and meet one of our consultant anaesthetists who will take them through that process. Prior to coming up for the Lipogems treatment, there are a few very basic pre-assessment investigations that we need to do. One is an MRSA swab, which we can get done for you at the local GP practice, or you can arrange yourself, or we can get that done at the institution where we carry out the procedure, which is currently the Nuwara Hospital, number 19 Harley Street, and the Weymouth Hospital in Weymouth Street. We'll do a telephone pre-assessment with you to run through some questions, but generally speaking, all we need is that MRSA swab. And this is something that we do for every patient in every hospital throughout the land before a procedure. Prior to being taken through, you'll be seen by the anaesthetist, you'll be seen by the surgeon, and you'll be consented. The main potential risks for this procedure are infection, but to date there's not been a single case of reported infection. And we think that's because Lipogems has a pro-antibiotic action. But it is a risk that we need to mention. And then there's a risk of bruising. And with the infiltration of the tumescent solution of that saline and adrenaline, sometimes we can get some bruising as a result of this or as a result of taking away the fat, but it happens to 1 in 80 and it's totally self-limiting. So this is a very low risk procedure. Once you're consented, you'll be taken through to the operating theatre. The whole process takes roughly an hour. As I say, this is incredibly well tolerated without any sedation, but probably it's nicer with sedation. The fat is harvested, it's prepared. This takes roughly 30-45 minutes, and then it's injected under ultrasound guidance. Immediately following this, you'll be monitored. We'll make sure that you're happy, you have a cup of tea, you feel comfortable, and then of course you'll be allowed to leave. For the sedated patients, they may wait for an hour or two before they're also ready to leave the hospital. What can you expect initially? Well, initially, actually things are likely to feel very good for the first 6 hours or so. There's a cytokine or a response from the growth factors that are released, which actually makes the joint feel really quite comfortable. But then it's likely to ache for a day or two. But this is not bad enough that you'd need medication from the hospital. This is something that can be managed with paracetamol and anti-inflammatories, simple analgesia. You probably won't see an effect of the Lipogems for 3 to 4 weeks. And from then on, you should start to see improvement. And we would hope by 6 weeks that we would see a significant improvement in your symptoms. So that's the journey of Lipogems. This presentation hopefully has been useful. If you want more information, I would thoroughly recommend that you actually come and see one of the Lipogems team, one of the members of the team, and we can walk you through the process in more detail. So please visit the website. That's www.theregenerativeClinic.co.uk. You can see it on the screen now. So please visit the website, have a look at the information that we've got, have a look at the testimonials that we're building, and learn and gain more knowledge about the procedure. One thing that I should also say is often patients need a life change if they're going to sort their joint out. It's not just the joint, it's your body. And one of the things that we've done as part of this treatment is to team up with Isokinetic, which is a fantastic physiotherapy unit in Harley Street, which is really unique. It's FIFA approved, and it's the only FIFA approved facility in the United Kingdom, and the facilities are phenomenal. And we've been very lucky to partner up with Isokinetic, and as part of our Lipogems package, we want you to go to Isokinetic if you're local and it's something that you can do. This is only going to be for people that can get into central London, and we want you to have sessions of physiotherapy and guidance from the Isokinetic team, because we think this is a very important part of your recovery, and also perhaps changing some of the aspects of your lifestyle that can better improve the way you feel and the way your joints behave. Thank you very much.